Welcome to the ring of Battle of Fields in MRI. I'm Luigi Lunetta, head of MR and CT business. In a moment, we will attend the Battle of Fields in MRI. Can we predict the winner? Technology progress has made the difference between high and low field MRI devices difficult to be made on field strength only. Modern scanners have very little to see with their parents from mid-80s. Then, what the winning factors will be. Let's see which expert uses weapon will be fighting each other and build our own choice. The referee of this battle will be a high-level one, Melissa and Rouget. Many of you have heard this name. She's an esteemed journalist from France and Spain. She specializes in healthcare and has been reporting about medical imaging from the past 10 years. Mel is a longtime friend of ECR's. At that time of the year, she usually runs between Room A and Technical Exhibition in Austria, Center in Vienna. Mel is used to moderating all sorts of battles, especially between little children, dogs, and even turtles. When the battle will be over, the floor will be yours. As Mel, we open a Q&A session. It's now my pleasure to give her the floor. Mel, the battle is yours.
Hi, thanks Luigi for the lovely introduction. I'm very happy to be here and welcome all of our panelists from all over Europe. So today we'll have two speakers of low fields and two speakers of high fields. We'll have Dr. Liliana Rechmeier, founder of a private radiology institute near Bonn in Germany. Dr. Mihaly Aradi, radiologist at Zala County Hospital and head of a private diagnostic center in Hungary, who also uses the Aperto. And our two speakers of high fields are Dr. Jan Veryser, founder and radiologist at Open MRI Zen, a private clinic in the Netherlands. And finally, Dr. Carsten Figge, senior partner and head of the MRI section of a private institute in Germany. He uses both the Oasis and the 1.5 Tesla Echelon Smart. So just as a reminder, this is a friendly battle to learn more about your experience of both low field and high field MRI. To show you I mean it, I've prepared a series of weapons for you today. This will be our first. This will be the second. This could be the third. And the fourth and last one, which also lights up in the dark. So this all goes to say that I really wish you a nice battle, and I will ask a question to each of you. And the audience is free to ask their questions also during the debate. We'll try to answer them all straight after the discussion. So we're now all set, and let the battle begin. My first question goes to Dr. Aradi, and it concerns image quality. So Dr. Aradi, it's known that high field MRI systems have more diagnostic options. Why did you decide for a low field MRI? And what are the pros and cons of a low field system compared with a high field one?
Hi, everyone. So we decided for a low field system because at that time, it was 7 years ago, we were starting private company and we wanted to have the best cost effective machine available on the market. And as we scouted around, we found that this Aperto Lucent was the way to go for us. And the last 7 years showed that we made a good decision, I think, because we still use the machine. This machine made it possible to step forward for a 3 Tesla machine also, but for a starter, I think it's a very good machine because for cost effectivity, it's really good. As for the field problems, so comparing a high field machine to a low field machine, there are several problems. Some are physical determined, like the field strength, and from the field strength coming the number of protons you can excite, and therefore the signal. So on a lower field strength, you have lower signal, but with the new digital signal processing techniques, you can extract more from the low signal. So these new machines are better than the previous ones. And also you can make longer examination, making more averaging, and therefore you can compensate for the lower signal. So on a lower field machine, you can expect slower examinations, but with a better patient comfort, it's not that big of a problem. Another physical property is the relaxation times, like the T2 and the T1 contrast. The T1 contrast is actually better on the lower field, so you don't have to fiddle around very much to have a good T1 contrast. On the contrary, the T2 is a bit slower, but it's not that bad. You just have to adjust your echo time to have a good T2 contrast, but you can make good contrast for all of the major measurement types on the lower field machine also. What is better on the lower field is the chemical shift, because you are using the same strength of gradients almost like on the high machines, but because of the lower field strength, the Larmor frequency is lower, and the fat and the water is not that separated, so you won't have that fat blur in your spin echo or any other images. So it's a bit surprising for a newcomer to see a lower field MRI image that it's not that blurry as on a high field, because it's the chemical shift is much lower, and also the susceptibility effect is much lower, so you won't have that much distortion around the metals. This is what we will discuss, I think, by the next question for the answer, that what is better on a lower field scanner compared to a 3 Tesla. But also the energy what we use to make an image is also much lower. So for those people who are concerned about the electromagnetic, how would I say, the amount of energy you get during an examination, the SAR, then on a low field scanner, you don't have to worry about it, because it's so low that the machine never stops by any examination. So for a pregnant or someone who is concerned, it's also the lower field machine is a way to go. And also because the machine is much simpler in construct, the running costs are much lower. In the previous 7 years, we did not have any major breakdown or problem with the machine, because it's not a superconducting magnet. It's just a permanent magnet. You just have to keep it at 37 degrees Celsius and not down to minus 270 Kelvin as on the superconducting magnet. So it's much lower for the running costs. So this is just a few things that's good on the low field. Okay.
Okay, thank you for this very, very complete answer. You've made the point very clear. And I thank everyone who's watching the session as well and want to submit their questions via the Slido chat. Please feel free to do so. My second question, we're going on the field of image, on the topic of image quality, and this is for Dr. Veryser. Dr. Veryser, what is your experience with your 1.2 Tesla Open MRI compared with the 3 Tesla system regarding image quality, but also artifacts?
Okay, hello everybody. So we have a private center and we have the Open 1.2 Tesla, but we have also a 3 Tesla Canon system. So we can compare very well. So first of all, we have rather good image quality on the 1.2 Tesla Open system. It's comparable to a normal 1.5 Tesla. And but we have to be aware that we scan the most difficult patients on the 1.2 Tesla Open system. So these are very difficult patients. They are or obese or they are very claustrophobic. So we have more artifacts, first of all, like moving artifacts, of course, because these patients are very afraid and they start to move. And also we cannot always perform the perfect examination. Like in many cases, we cannot use the dedicated coils because they are very afraid, and so we have to perform a less performance examination, but nevertheless, we have very good image quality. Of course, it's not like 3 Tesla, but it's very good. And some examinations on the open system are even very good, especially when you can use the normal coils, like a lumbar spine or abdomen is very, very good, and even comparable when you can do the perfect examination with the 3 Tesla images. Concerning the metal artifacts, so the field strength is lower than a 3 Tesla, so we have little less artifacts, but we must be aware that a little better on the 1.2 Tesla. I would also like to say that in many cases, for many patients, claustrophobics, it's about 5% of the population. It's the best image we can get because they cannot enter any circular system unless you do general anesthetics. So anyway, when the image quality is less because the patients are very difficult to scan, we have an examination, which is very good also. I told you in a short time the big advantages of the 1.2 versus the 3 Tesla we also have.
You made the point, and you've talked about an important part of the population.
Yes.
These are just not numbers. Okay, thank you very much. Dr. Figge, how do you achieve high image quality and high throughput with your 1.5 Tesla system?
And everybody knows the number discussions radiologists have. Oh, could we reduce the scan time for this sequence maybe in 15 seconds or other sequences 30 seconds? So we can reduce the overall scan time in 1 minute and 30 seconds. Everybody knows this discussion. But I don't want to avoid this number discussion. In my opinion, there are different steps which assist us. And the first step is preparation, philosophy, and the second step is technology. In my opinion, you need an all-embracing philosophy for your institute. Our philosophy is to be open-minded and patient-centered. The patient and his needs are right in the center of our looks. So we look for them, and this is the most important point for me. You need, so in this way, highly trained employees and highly trained technicians. The employees at the desk should look for the informations I need. They collect them, then check them. And every patient who is coming to us is anxious because he has a problem, a medical problem. So he is anxious too. And we have to calm him down, talk to him, prepare this. And preparation of information, if you lose information, it lasts longer than 30 seconds. When we go to the examination, talk to the patient too, ask for their needs, help them, assist them. And that's why we often need no chemical assistance. I call chemical assistance when somebody needs drug to calm patients down. We don't need drugs because we have technicians who talk to the patient. So I want to avoid these number discussions with this help on the one hand. And on the other hand, I need technology. Dr. Veryser talked about the wide open design of the Oasis. We have one too, and claustrophobic patients are all over the world the same. They make problems, they move, they are anxious. But keep in mind, younger patients might have a sort of a noise problem. Noise could be very, very stressful. So use technology which reduces the noise of the examination. The Echelon Smart we use has the soft sound technology. So the typical examination has a noise of 90 dB, and we could reduce that to 60, 65 dB. But keep in mind, 3 dB less is half the noise. So we could reduce the noise markedly. And this supports the patient. I don't want to talk about the friendly design of the scan rooms, ceiling windows, light design, real windows. That's clear for me. And I think the additional technologies like Rapid or Synergy Drive or auto positioning assists us too. And this is clear for me. So in my opinion, number discussions are not needed anymore.
Okay, so you'd rather talk about being well-trained, highly prepared, and using noise reduction software?
For example, noise reduction, yes.
For example, okay. Anyone has anything to add to that? I mean, it's a very patient-oriented answer you gave. It's very good. Anyone wants to follow up, or we can still go on talking about patient and actually their comfort, which is quite important for MRI and to all of you. So I had another question for Dr. Rechmeier this time. What kind of patient feedback do you get in terms of comfort with your 0.4 Tesla system?
Well, I agree with many things my colleagues already said. I have been working for more than 5 years now with the Aperto Lucent, and one of my great concerns is to clear up with the prejudice. The Open MRI is an add-on machine for only patients with claustrophobia or bariatric patients. These are cases in my practice, they make up 2 to 5%. I speak here for the majority of 95, 97%, and these are normal patients, however, meaning they have no special needs, and though they hugely profit from the comfort the Open MRI entails, comparing to the tube that normal people think of when they hear the word MRI. And not only claustrophobic patients are they didn't like when to be stuck in a narrow place. So when our patients enter the room, they are positively surprised by the nice decorated place. The colleague also told about it. The room is not cold or technical. It's really like a hotel lounge, very comfy, and the temperature is normal. It's not cold. It seems to be a very great advantage not to lying in a cold there. There is music, so they can hear music from the speakers. The machine is not loud, and laying on the table, they have this panoramic view, so they can stretch out and see that it's not a confining problem. So it's that what patients directly love from this feeling to have it, and it's generally possible to have someone to stay with you in the room, children with their parents, or if there is really a person who suffers from an anxiety disorder, of course he has someone to have with him. But a great advantage is also that they can fall asleep if they want, but generally we don't need any drugs. That's all. We speak with the patients, and they feel the atmosphere and they love it. And in my opinion, if the patients have the choice between a normal MRI or the Open MRI, they choose the normal, the Open MRI.
Okay, well, Dr. Aradi, just making a small coming back, jumping on the idea that Dr. Rechmeier was talking about. You also use the 0.4 Tesla Aperto. Is that something you agree with in terms of patient comfort?
Yes, it depends on the patient. So if the patient is claustrophobic, we can arrange the schedule. We don't have so much patients because we are fully private, so we can afford it to have the time booked also for the 3 Tesla and the 0.4 Tesla, and just when the patient arrives, he can or she can decide which machine he or she can handle. But we have the Siemens Skyra, which is also a 70 centimeter wide bore. So the 3 Tesla is also not that narrow, but the 0.4 Tesla is better in comfort because it's more silent, it's more open, and also the image quality is also good for the routine imaging. So for routine imaging, they can really go with the 0.4 Tesla. Okay.
Okay, thanks for sharing this image. Dr. Veryser, we've mentioned a little bit claustrophobic or intimidated patients. How do you handle these special patients?
Yes. First of all, I want to tell you, before I had the 1.2 Tesla, I was working 10 years on the Philips 1 Tesla Panorama, also open system. So I have a lot of experience with claustrophobic patients, and I want to tell you 5% of patients are really, really claustrophobic that you cannot get in a tube. Yes, cannot get in a tube. And 30% of the people are a little bit claustrophobic. So it's very nice to not go in the tube, so in an open system. And I want to tell you also that 1.2 Tesla is first of all more than 1 Tesla Panorama of Philips. It's also more open. Yes, it's open 27 degrees. So the pillars are smaller and the patient always looks outside. On the Panorama Philips, the patients looked at the pillars. Yeah, the pillars were bigger. Now the pillars are oblique, so the patient always looks outside of the bore, which is very important. That was a first remark. So second remark, somebody mentioned the noise. That's also very important. So we have also the 3 Tesla from Canon, which is very silent, the most silent on the market, and which is also the widest bore, 71 centimeter, and the table is 10 centimeter lower. So that's also very important. But nevertheless, 5% of people don't go in any bore. They don't go even in the best bore, even when he's silent, and when he's even bigger, even I think when he should be 80 or 90 centimeter. So these open machines are, I think, very important to have in a big part of the population scan. Before there was one open system in the whole of Belgium, that was in Knokke, which I did for 10 years. Now there is no open system anymore in the country of Belgium. So, and we put it on the border in the Netherlands because we can do it in the Netherlands in a private center. So we get all the claustrophobic patients from Belgium and a big part of the Netherlands. Yes, because in the Netherlands is also 2 systems. Yes, one in the north, one in the south. And the Philips systems are going because they are not produced and not supported anymore. How we treat claustrophobic patients, I will tell you with a lot of care, love, and time. Yes, so these are very, very difficult patients, and the real claustrophobic patients, they don't even enter the changing room. Yes, so we have a big changing room. Yes, a big changing room. Also, we are not a hospital, which is also very good for claustrophobic and anxious patients. We have a private, very nice private center, and from the entrance of the center to the scan room is only 10 meters. Yes, and it's also very nice decorated and things like that to reassure the patient the investigation will go good. So further, we talk a lot to the patients. We take our time, we introduce them. Also, when they make the appointments, we advise them to look at the system, especially to see it's not a tube, because they're so scared of a tube. Yes, they think they will die in a tube, like in an elevator. So we talk a lot with them, and then we introduce the machine even before they go in the changing room. So we say, this is the system, and we make them an adjustment to the system. Yes. Also, parents or children or friends or whatever, or somebody of us, they can go inside with the patients. They can sit next to the patient, they can hold their hand, or they sometimes even go inside next to the patient. Yes. So that's how we make them feel more comfortable. Also, during the examination, we make ourselves present, so we talk all the time in between the sequences to the patient, and we speak positive. We say, you do very well. Yes, and this helps very good. So this is how we try to scan claustrophobic patients. And I want to tell you, because we do it in a private center, so we invested a lot of money, and the patients are really, really very, very happy that they can come here. Yes, and also a little mad on the Belgian state that there is not even an open system in the country. Yes. So.
And do you ever get patients from France, from the north of France?
Yes, yes, from France. We even get patients from Frankfurt, Germany, England, everywhere. Yes, we had one patient from Algeria, and he needed to be in Amsterdam, and he looked on the internet, and he slept in a hotel in Bruges, and he came in the morning to us. He was here at 8 o'clock, and at 12 o'clock he was in Amsterdam. Yes, so claustrophobic patients will travel very far for the system.
Please tell them
the real ones.
Tell them they could go to Paderborn too.
Where is that?
Tell them they can go to Paderborn too. Please tell them from Frankfurt.
Yes, why not? Why not? We should make one one company together, all together. Yes.
Yes, let's do it.
Yes, but the other system in the Netherlands is in the north in Hardenberg. It's 7 hours driving from here and back, and we decided to share the Netherlands. So the Rhine is in the middle. Yes.
So did you, I imagine being claustrophobic, I could drive a lot of kilometers to have a comfortable examination.
Yes, and for the claustrophobics, there are only two alternatives: or they have to be scanned with CT, yes, or they have to be under general anesthetics, which cannot be the intention, I think, to do that for one examination. Especially patients who need a lot of MRIs, they cannot go all the time in general anesthetics. My opinion.
Yeah.
Yes,
Definitely. I have just a small parenthesis on patient comfort. I've just read a book about mindfulness that said that even some patients are so comfortable during MRI examinations that they can even relax. Has that ever happened to you? That's something you hear?
So we are specialized in claustrophobics. Also, the Canon system is very good, and patients, they fall asleep. They are so relaxed, and they really like it. And also, the atmosphere is relaxed. We are private, so we talk to them. We take the time for them, which is also a little bit costing us money. Okay, but so it be. But we need time for these patients.
Obviously. Yes. Okay. So thank you very much for taking the time to talk about this important topic. You've mentioned money, so this would bring me to our topic of total ownership costs. I mean, it's also a reality. And there I'd have a few questions, and I would first direct the first question to Dr. Aradi. Are high field MRI systems better as much as they're more expensive than an 0.4 Tesla MRI? That's a bit provocative.
Yes, but I'm just going back to my first question that these are two separate kind of systems which are different. There are some pros and cons on both machines. Of course, the advanced applications are on the 3 Tesla, but for the routine imaging, it's two feasible same options, and we even after we have the 3 Tesla we have been using it for 2 years, we still use the 0.4 Tesla, and because it's practically so cheap to maintain that it's not worth to sell it. It's much better to use it because this permanent magnet is really very low cost maintenance, and there are plenty of patients where it's very good. So by the metal implants, and for those who only need routine neurological like brain, spinal imaging, and so on, the cost effectiveness is really good, and also I sent to János some images. Maybe if later needed, I can send it to you also. So the biggest advantage is by metal implants, the distortion can be so little that even near the metal you can see the problems. And for spinal surgery, it can be really crucial for a myelin lesion or something to be visible. So I think to have a 0.4 Tesla by a big field machine, by the big spine surgery centers, it should be essential because they do not know what they miss And what is really good by the Aperto, which we didn't mention as prominent as it should be, that its image quality is really good. So not just having a good patient comfort and something that is silent and relaxing and okay and just get over with the examination, but at the end of the day, you get a full quality examination. You, as a radiologist, you can tell the problems from the images, and this is very important because the claustrophobic patient needs the same quality of evaluation as the normal ones, and this 0.4 Tesla machine is capable of having full quality measurements, and this is why we like it and why we use it by the 3 Tesla, because for the actually for the spine examination, it's almost like the same. So it's really important to clarify that this machine can be used as a good quality image. As Renata knows, for the claustrophobic patients, we have plenty of protocols. We can do on the Aperto even 2-3 minutes examinations with almost 100% diagnostic quality. So, and we also do pelvic imaging and abdominal imaging, and of course you always have to know what is the limit. So you have to tell the patient that this machine can do this and this. You have to decide. But for a patient who cannot go into the tube, as the previous speaker told, it's really important to have a diagnosis. Then this 0.4 Tesla machine can be used. This is what so I think it does have a place by the high field system, and of course not for the advanced imaging, so not for liquid dynamics and cardiac and so on, but there are still plenty of patients that need and specifically asks for the lower field machine once they have been there actually. So I think, and this is why it's good to have a 3 Tesla and a 0.4 Tesla, because the 1.5 is not that better from the Aperto. And this is why we chose actually the 3 Tesla Skyra. Aperto can be so good if you compensate for the lower, so the problems of the lower field, like measuring longer and giving more time for averaging, that the 1.5 Tesla machine for us wouldn't have been a big step forward. So I think having a 3 Tesla machine and the 0.4 Tesla machine is a really good thing, and then you can cover almost anything with MRI.
Okay, I feel Dr. Figge could have something to say about that, maybe having the 1.5 Tesla machine. I don't know. Do you want to react?
Yes, we have the 1.5 and the 1.2 Tesla machine.
Yes.
And I think both are worth the money. Both are different. And if you have special patients, I call them special patients, not only obese or claustrophobic, then you can choose the 1.2 one. And if you have the normal ones, choose the 1.5 one. And they are very close in image quality, no real difference.
Okay. Anyone wants to add anything at this stage?
Yes, I want to add something that's very much true what my colleague said just about the 1.2 Tesla. It's also a vertical system, and you can also adopt a table in the horizontal way. So you can always put your joint or whatever you want to scan in the center of the field. So it's very comparable to 1.5 Tesla.
Okay.
Yes.
Okay, great. Great. Well, and thank you, Dr. Aradi, for explaining how you use the 0.4 Tesla in more details. And we've pictured pelvic, abdominal imaging. It's just more precise. Okay, so Dr. Rechmeier, this question would be for you then. Why did you specifically choose an 0.4 Tesla MRI?
You mean about the costs? Are we in this?
Yes. Yes, this was our topic, but then you can also expand.
Okay. Well, there were the three criteria which I had to think of. The first was the image quality. I am a radiologist, my husband is a radiologist, and I have to say we are very happy with the image quality the Open 0.4 is doing. It's generate really good. Then secondly, the patient comfort is fantastic. So the two were big points for us. But of course, as an owner of a private practice, I had to think economically. And the calculation shows that the Open MRI with this permanent magnet, as the colleague also already said, is about, I think, 60% lower in the running costs compared to the superconductive MRI. This means the service, the helium, the power, and I think also the building costs. That means very much in the sum if you are going to put it for, I don't know, 8 to 10 years. It's really a lot of money. But the three criteria were in sum that what it means to me. And we have a private practice in Germany. Private patients are the patients who bring the good reimbursement potential. That's the point, and they really often choose open system. They are they came from a longer journey to come to this Open MRI, and look, the fact that we have a really large number of patients who are coming back for follow-up treatments or for new treatments speak to the fact that they have experienced a good operation mode in this Open MRI. And I would like to think that it's my personality or my good radiology thing, but they really told me it's the Open MRI and this experience. So there we are. What I've forgotten to say, and what it's really a new thing, and I think it's an extraordinary thing, we do very much pain therapy. And the Open MRI gives us the possibility to do pain therapy without any X-ray exposure. So many patients, of course, want to have pain therapy without any danger. So the Open MRI gives this possibility, because it ensures the possibility to have the access to the patients from every side. And this also is a good cost problem if you want to think about it. So I would go for the Open MRI anytime again after 6 years.
Yeah, 6 years is a pretty good time to judge if it's working or not, right?
Yes, and I know that the new system of the 0.4 is going to be much more rapidly. I think it will be an indirect comparison to the 1.5 Tesla. So we will see next year. The new one is on the market now.
Okay, well, we'll see about that. But your experience also speaks for itself. You're very, very, very clear with what you're doing. You just mentioned something that's going to come in the market, and I think it's specific post-processing techniques.
Yes.
Yes.
I think we have the first question I saw on Slido about the post-processing techniques.
Oh yeah, you've been checking that.
But I think it's this direction. Yes, I didn't see the new system, but I know it is a new system, and I'm glad to see it in short time. The 1.4 the 0.4 is going to be very rapidly, and they say it will be the new 1.5 and open.
Okay, but they will make your job easier. This is something you're looking forward to? I mean,
well, of course, it will be much more faster. This This is the problem. It's the only thing I didn't see it yet, but I invite everyone to see an open MRI and to lay on the table and see what's the advantage. And once you're laying down and see it, you get it, and you see what the advantage is. And I'm sure then if you see, for example, images from I don't know, take lumbar images, I don't know what, and you don't know if it's from an open MRI, you would take your prejudices and put it away, because it's really fantastic. It's really good. The colleagues said it, or Dr. Aradi said it already. It's really good.
Right. Okay. Well, that sounds promising.
Can I add something?
Yes.
Just what maybe that wasn't so clear, that the difference between the 0.4 Tesla Aperto and the Oasis, that it's open, but the throughput of the Oasis is much better. So we are not saying that it's so the Aperto cannot solve everything, but for a low patient number place, it's a good MRI alternative. Of course, the 1.2 Tesla is better, but it's more expensive also. So you have to customize the MRI system to your needs and to your patients. So you have to pick according to your demands. So this is what I just wanted to add.
Thank you for that. Thank you for that. Anything anyone wants to add, or should I move to another question? Okay, so I'll just go on with Dr. Figge then, with the question I wanted to ask you that's still on total ownership costs. You've got both the 1.2 Tesla and the 1.5 Tesla. So in your opinion, which system offers the most attractive installation, running, and maintenance costs?
Yes, let's talk about costs. When we talk about costs, I want to talk about technology, feasibility, and income too. On the one hand, we have costs, and on the other hand, these three big points for me. Let's talk about technology. For example, the Echelon Smarts offers us the technology to reduce the online time of the air conditioner or the cooling system. We will shut it off on weekends or when we are not scanning. So the economically costs could be markedly reduced with technology. In my opinion, in the range of 10 to 50% maybe. So technology. Let's talk about feasibility. In 2018, we wanted to install a new MRI, and we had a possibility to rent only 135 square meters in the neighborhood, in a building nearby. And there was a second problem. There was an underground car parking entrance right under this area. And we talked about different vendors, and two of them quit. The first said, okay, you could install an MRI at 135 square meters, but nothing else. That's bad, or was bad. And the underground car park entrance, the second vendor said, no possibility to, because of magnetic field inhomogeneity. Use feasibilities, yeah. And the second point, and this is a very important point, we always talk about cost. To be different, to be open-minded, to be a problem solver could be, as Dr. Veryser said, he will get patients from all over Europe, I can say. To be different, to be a problem solver is like a lighthouse. And so if you have the philosophy to be different, the income rises. And we made we had in the past our income rised a lot and still rises because we are using a 1.2 open MRI. So in my opinion, both machines are worth the money. They are different, but worth the money.
Yes, there's many things to take in the equation, right? Mentioning the parking, I don't know, just all these issues about how much money is going to come out and coming. Anyone wants to react on what Dr. Figge said? Any experience you can share with how much you spend and how much you earned?
Maybe something. I think we are in the worst place here in Hungary because it's fully, the NHS does not fund anything, and there is no very little private insurance in Hungary, and we are fully private. So we only get paid by the patients, and this is why we chose the Operto in the first place, because we didn't want to go bankrupt. And actually we could build also a clinical practice around it. And now we are expanding to our third installation of the buildings, and we have planned many of clinicians and everything. And with a good diagnostic center, you can have clinicians, and you can get income, and you can have money also fully private. So I just wanted to tell you that even with the worst case scenario, what we have here in Hungary, we were able to still stand our ground and operate fully private. And the Operto really made, and because the Siemens is a very expensive machine, we would have went bankrupt if we would have chosen it at the first place. So it's for the Operto, it's a really good background that we can rely on it, because if in any case in the future there is something wrong, we still have the machine. But and this is what I just wanted to tell, that even in the worst case scenario, the Operto, we would have liked an Oasis, but the Oasis wasn't available at that time in our place, and it was also more expensive. So to us, to be fully private, it wasn't that good an option. But the Operto still managed this harsh Hungarian financial environment.
It's yes, it's a machine for many settings, right?
Yeah, yes, and people don't. So in Hungary, it's a bit of a poorer country, so you cannot ask that much for the examination. It's around 100 and something euros for the Operto, and also for the 3 Tesla, you cannot ask much more. Around 40% more you can ask, and so to build up a clientele that can finance your working is time. So it takes years to have enough patients to generate enough income. And this is why it's good to have a permanent system at the first place, because even if you don't have that much patient, you cannot go bankrupt that easily. And if you have the patients, then you can go for a better system. You can go for the 1.5 or the 3 Tesla. So to start off, I think a 0.4 Tesla machine is a good option.
Okay, Dr. Rechmeier, anything you want to add?
Yes, I think we should point out we all 4 are radiologists, and we all are really very well with our open MRIs. We have perfect images, and that's this prejudice. The open MRIs having good images is really we should finish with it. It's a really good machine, even if it's 0.4 or of course the 1.2. It's another level, but I think the post-processing made this machine in a really serious MRI. It's not something for a kid. It's really a machine for a radiologist.
Machine for grown-ups.
Yes.
And the MRI is a much better imaging alternative compared to ultrasound or X-ray or CT. Of course. So this is why the 0.4 Tesla is a good, because it's an MRI, and it's an MRI, even if it's in the lowest part, but it's an MRI, and it's much better because the ultrasound is I like the ultrasound, but it's it's just for screening. You know, if you want to make serious decisions, you have to have an MRI. Yeah, and yeah, okay.
So we're moving the battle a bit away from field high fields to ultrasound. No, but it's a good point. Dr. Figge, Dr. Veryser, anything you want to add about, I mean, you're obviously with your systems, you're absolutely working with MRI and only MRI, right? And no room for anything else.
A lot of room for different examinations like CT, etc.
Right, okay.
In the past, unfortunately, we started with an Oasis, and it was on the only machine we had, and it worked too. So maybe it's a little bit different in Germany than in Hungary. And we added the 1.5 Tesla smart afterwards. So we are different.
Yes.
Dr. Veryser?
Yes, one little comment. So we in our center, we have ultrasound and MRI, and I believe very much in the combination because also MRI is not perfect. Like I do, especially musculoskeletal. So, and I like to perform ultrasound together with the MRI because the resolution, I use a very good Canon ultrasound machine for superficial structures is much higher on ultrasound. It's a rather difficult learning curve, okay, but the combination is also very good because you can also do dynamic examination on ultrasound. For example, I see a lot of important sports people, and we can look at the ligaments of the ankle on a dynamic way on the ultrasound, and we have much higher resolution in the ligaments and the tendons than on MRI. Everything you don't see on ultrasound, you see on MRI and vice versa. So what I mean is this, we don't use any X-ray, yes, and we see everything. And in that point, my colleague is right. In fact, with ultrasound and MRI, you can perform almost anything in radiology, I think.
Yeah, this is, yeah, I agree with you. This is not what I wanted to mean. I do the same.
That's why I,
yes. Yeah. And
that's
actually,
why I reply a little bit.
Yeah. Okay, thank you. Okay.
Yes.
So we can all agree we're all different, low fields, high fields, but in the end, it's MRI. So
yes,
we can all unite on that, right?
Yes, and I think with ultrasound and MRI without X-ray. So before we were radiologists for radiation, I think we need to leave the radiation. And yes, I think it will end up like this in the end. Everything MRI and everything. And also I want to add one comment, like in future, and it's true also, low field can be more important because with artificial intelligence, we didn't see the end of this yet. And we can get much better images out of lower field, I think. Yes.
Yep.
Yes.
Do you have, one of you, experience with pain therapy in MRI? Did you?
I did because we had before the Philips open system, so we did treatments, and I learned this in very important centers in Germany, in Charité in Berlin and Magdeburg, which are reference centers in this. And but it's very time consuming and I think very difficult. And now I'm busy with fusion. So 3D MRI and or CT even, and we take it on the ultrasound, and then we have all the time to do treatments like pain treatments or whatever treatment.
But it's really good. You see the needle exactly.
Yes.
It's really perfect.
Yes, I know. But when you can take your MRI with you, and like for example for a prostate biopsy, and you do it under ultrasound, and also the advantage of this is that you can. When you have a CT with a contrast and you need the right phase, yes, then you take your CT or your MRI with contrast on your ultrasound, and then you can do liver biopsies or liver treatments or whatever on your ultrasound. Yes, that's a little remark, but I did the interventions on the open machine, 1 Tesla Philips.
Yes. It's a new world.
Yes, it's a new world. But again, with fusion and MRI and ultrasound, I think we will see nice things in the future, I think.
Yes, of course. And with this pain therapy without radiation, it's also
without radiation. That's very important. So with ultrasound and fusion can be an interesting option for this also. in the
Okay.
future.
Yes.
Thank you. Thank you so much for all your input. We have 5 minutes left. We could take some questions from the audience, if that's okay with you. I think there was one for Dr. Figge here, since you have a 1.5 and a 1.2 Tesla. And someone just asked, which criteria do you use to select patients for 1.2? And well, this would also go to Dr. Veryser using 1.2 versus 3 Tesla. Whoever wants to start.
Maybe I could start. Yes, we choose the machines and the examinations in different ways. For example, prostate imaging is a little bit better with the 1.5 Tesla machine than with the Open MRI. We did a lot of prostate imaging in the past with the Oasis, around about 5,000 examinations, and it works. Yeah, no problems, and our results are very good. We proved that, nowadays we say, okay, it's a little bit better. The contrast is a little bit higher with the 1.5 Tesla machine. So for prostate imaging, I choose this machine. For musculoskeletal and neuroimaging, both are the same. There's no real difference. So you can choose whatever you want. For breast imaging, we will choose the 1.2 Tesla Oasis because it's more comfortable for the women to lay on the table. The breast is downwards, face down. It's more comfortable with that machine than with the tunnel design. So for breast imaging, I would choose the 1.2 Oasis. Yeah. Abdominal imaging, now maybe the image quality is a little bit better with the 1.5 Tesla than with the 1.2,
Okay.
but it works both.
Okay. Okay, Dr. Veryser, anything on
Yes, so,
this? I mean, how do you
yes,
select?
so we have a bigger difference. So we have a 1.2 open system and a 3 Tesla. And we have a very special population, like I told you, with claustrophobic. So we try to make the best image. Yes. Like for a knee, for example, we in the very big bore from Canon, the biggest on the market, we can put the knee inside because the patient don't go inside. So we try to make the best image. When he really don't want even to get close to the tunnel, then we use the other system. So first of all, we look what examination we can make the best for the patient. For breast imaging, we use the very wide bore from Canon because we have 10 centimeter more in the height. So some people, the open system is 50 centimeter. Yes, so the circular one, the tunnel from Canon is higher. It's higher. Yes, but some people don't want to go inside, so then we use the other one. So we use both, and that's a little bit the intention of the center is for this population. Especially because for claustrophobic patients in Belgium, there is nothing. So we choose the two, in my opinion, best systems, and we try to make the best image in the importance of the patients. Okay. Yes. Okay. And also, I think the 1.2, as I told you, in my opinion, is a little bit comparable to 1.5 normal tunnel, in my opinion.
Dr. Veryser, I'm so sorry to cut through. We're running out of time. This was very, very interesting. Thank you, everyone. And just as a short, we will answer other questions after the video is over. But just to mention, we mentioned post-processing and software. So check their website and you'll read more about that over there. Thank you so much, everyone, and have a great afternoon. And see you in the chat for further questions.
Bye.
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 Thank you. Thank you.
Bye-bye.